I know even in my friend group, so I think in my core friend group, I'm the only person in recovery. I'm the only person that's experienced addiction firsthand. And when it comes to the topic of helping people on the street or giving money to somebody on the street, it's a very controversial topic in the sense that a lot of people are against it, right? A lot of people are like, you can't help those people. They're all, they're faking it, or you're going to give them money. They're going to go use that money for drugs.
Correct.
And I've never felt that way. And I think obviously it's because I've experienced things differently. I've always been of the mindset, well, I can't fault somebody for using drugs. It's kind of the hierarchy of needs. I mean, you don't have access to a roof over your head. You don't have clean clothes. You don't have any connection with people around you that care about you and love you. You don't have a job. So if you don't have any of those things, I can't walk up to you and be like, why are you using drugs? You need to stop immediately, right? Correct. We kind of have to have a little empathy and understand that there's a lot of layers to it.
Yeah. There's a lot, even it can go way back as, you being a child, you could be abused, and that's why people use drugs or become homeless. You don't know what someone's life story is like.
1,000%. Yeah. And we had this conversation yesterday, and I've experienced sexual abuse as a kid. He did as well. And we were having the conversation of like, without a doubt, 100% of people that I know with substance use disorder have some sort of childhood trauma.
Correct.
100% of the time.
Yeah.
And so, it's not that it's not really a drug problem. It's the fact that somebody doesn't have the tools. They haven't been taught the ways to deal with the stuff that they experienced. The only thing that's worked for them thus far is drugs. And then as we know, that's a slippery slope into, homelessness and all kinds of issues and
death.
Death.
Yeah.
Ultimately. Yeah. Death is ultimately, unfortunately what happens. But I've always, for me, it's like, I can relate to what you do because I do it a lot as well. I'm always quick to give somebody money. I don't have an expectation attached to it of, wanting to control what they do with it. I understand that sometimes you try to help people, they're going to use drugs. It's just going to happen.
Yeah.
When you do it, like there's also a lot of like, do you agree with me when I say that? Like, when you give somebody, I guess the way that I feel about it, that's a little controversial, is I'm kind of the mindset, okay, if somebody asks me for $20 or somebody asks me for $1, if I give them $1, give them $10 and they use that for drugs, I don't really care, because going back to what I said is, well, yeah, but look at the situation that person's in. If that's the only relief they have today, do I want them to do that forever? No, obviously we want them to eventually get on the right path. But I feel like the first step to doing that is just having that connection, right? It's the way that you might drive up to somebody and ask them 10 times if they want a job. You might give them a few bucks. The first 9 times they might use that to buy drugs, but you're still having 9 opportunities to have a connection with that person. And then maybe the 10th time they're like, you know what? I think I'm ready for help.
Yeah. You're basically just planting the seed. You keep asking them and asking them. Eventually they're going to take you up on that offer, hopefully. And then it's scary because it's not guaranteed. I mean, I don't know your numbers, but as far as like the people that you help, I'm sure a lot of them revert back into old ways as well. And so that's a tough thing to reconcile. And that's, looking in from the outside, people that haven't experienced it, they look at that as failure. But I probably did 10 different, ways of trying to go to treatment before something stuck. Yeah, it never happens in the first time. It's very rare.
Yeah.